So hi everybody, I'm here with Dr. Neil Busis, a member of the Neurology Today editorial board and a neurologist at NYU Langone Medical Center. Dr. Busis has an interest in wellness and in dealing with burnout among faculty members and residents. In these challenging times, I thought it would be helpful to ask Dr. Busis, just his general thoughts about how faculty and staff potentially can create a healthier environment to alleviate some of the stressors related to caring for patients during these difficult times with the COVID pandemic. So Neil, let us know what you think about that.
Well, thanks for asking me to contribute. I think the way I'd frame it is this. The big picture is that COVID made certain problems in the healthcare system worse. And burnout is one of them. So there are still the usual causes of burnout related to workload, autonomy, technology, et cetera. And then there are extra ones by this incredible biologic tragedy. To get prepared is the first step. The leaders of the National Academy of Medicine Action Collaborative predicted that with the global pandemic, there would be a parallel pandemic that threatened clinician wellness. Physicians, every other frontline worker, nurses, nursing assistants, et cetera. So first of all, to acknowledge that burnout is a problem, to prepare for it, and then to be aware, as we've become, especially in New York, having very early experience with it, with the idea of a pandemic curve. The needs of the clinicians will change depending on where you are on the pandemic curve. So at the very beginning of the curve, you're worried about basic needs. Can I eat? Can I drink? Can I take care of my kids? The way to respond to that is to provide. At the top of the pandemic curve, have we crested? Have we not crested? Where are we going? Lots of uncertainty. And the way you deal with uncertainty is communication. And then as the curve starts to go down, people are processing what they've done. At the peak, they're working on muscle memory and adrenaline. And then as they start to process, there's a whole other set of things that come in, almost PTSD-like things. And there you want to support. So you have to understand that the needs will vary, and it's going to vary locally because look at different parts of the country are in different parts of the pandemic curve. And not only that, if you look at the New York Times, which puts the coronavirus numbers every day, there's been like 3 different bumps in our country since March. And so you may actually go back up, and you may go through several cycles of this in your healthcare organization.
Yeah, that's a very interesting way to think about it. And somebody recently told me, while COVID itself has created a whole host of new problems, what it really did was expose many of the underlying problems that were sort of festering under the surface, right? The idea that, it really took a pandemic to bring up to the surface what we sort of already knew was happening. And so I think it's probably a combination of those two things. So given the fact that, many parts of the country are in the thick of it right now as we speak, and some parts, like hopefully ours, but I'm not so sure it's going to stay that way, are sort of, although creeping a little bit back up, certainly past the initial curve. What should we be doing to, sort of be like, we need to be paying attention, of course, to our colleagues to make sure they're okay. But what should we be doing to address, these kinds of stressors among our colleagues?
That's also a great question. And I want to give credit for this response to Jen Milano, who's one of the AAN Live Well, Lead Well program and Wellness Joint Coordinating Council leaders. She came up with this. It's called the 3 R's, and it's recognize, respond, and refer. And this deals with both yourself and colleagues that you see. So you should first be on the lookout for signs of distress, which include changes in mood, irritability, avoidance, dissociation, anxiety, sleep difficulties, increased substance use, unexpected physical symptoms. And then respond. It's different, of course, if you recognize it yourself, but if you recognize it in someone else, try to be neutral, non-judgmental, listen calmly, find a quiet space to allow them to talk, allow them to share your story. And then if you think that they need help, you try to refer and encourage them to seek support. as needed. Now, that of course presupposes that your organization has resources for people like that. And I think there's a really interesting point that's been brought up by Jo Shapiro of Brigham and Women's Hospital. She's an ENT physician who has done extensive work with peer support networks. And what she says is that because there's still a stigma in our society about anything that smacks of mental health, that people will tend to avoid as much as possible going through and seeking help. It's not true that if you build it, they will come. And so that's why she emphasizes peer support. She thinks that it is much easier for people to speak with their peers, other physicians if you're a physician, other nurses if you're a nurse, et cetera, than to go to some external type of resource. And but one can imagine a number of different kinds of resources available in your hospital or your organization. Ones that deal with basic needs, if that's an issue. If you are being pulled to be in some ICU and you haven't been in an ICU in years, to have programs to train you for your new temporary role. If there's issues with moral injury, which is you either see or do things that you know aren't right, but you have to, triaging, ethics, all those sort of things, another set of counselors. And then, of course, the peer support and connection. So different problems will require different solutions. And she, I think, makes a great case for peer support as being one of the most frictionless ways of getting a lot of that support.
Yeah, I think, framing it a little bit differently, it's okay if you're not okay.
Right.
2020 was a hard year. And I think, as physicians, especially, we always say doctors are the worst patients. And, I think partly because we never recognize the symptoms of disease in ourselves, right? We sort of blow them off. And I think it's similar with mental health, right? We sort of sweep things under the rug and don't acknowledge them. And I think part of that might be because it might be viewed as a sign of weakness. And I actually think it's a sign of strength, right? To acknowledge when you maybe aren't okay and you do need help. And I think sometimes if you're unable to acknowledge it yourself, having a colleague call it out for you in a non-judgmental way, especially during these difficult times, is important. And I hope that the culture, one of the things that will come of this difficult time, is that the culture of medicine will change a little bit, in that it is okay to admit that you need some help, and it is okay to admit that you need a little bit of a respite and some resources.